My name is Sergeant Chapkun, and I would like to welcome you to this Usenix Security panel on digital contact tracing. Digital contact tracing has been recently proposed and also deployed as means to contact trace people in this COVID-19 epidemic, meaning it is a mechanism through which contacts of about 15 minutes within 2 meters distance could be detected between people in order to inform people that they have been exposed to COVID-19 in case that one of their close contacts was tested positive for COVID-19. So this is in a nutshell what contact tracing is supposed to be doing. Manual contact tracing already does this by essentially asking infected people to list their recent contacts. Digital contact tracing would make this process less labor intensive and also would enable the detection of those contacts that normally would not be captured by manual contact tracing, such as those happening in public transports and in public places. Digital contact tracing notably will leverage existing devices such as smartphones or bracelets, and also existing technologies such as GPS and Bluetooth in order to speed up its deployment and use. There were a number of proposals for digital contact tracing. The community has been extremely active in this space. However, it would take a long time to describe all of them. Instead, I'm only going to mention exposure notification framework by Apple and Google, which has been already deployed in Android and iOS operating systems, and also deployed in a range of European countries that you can see on the list on the right. This exposure notification framework is on the surface extremely simple. It relies on Bluetooth low energy advertisement beacons that are exchanged between the phones in order to enable both proximity detection and also to enable the discovery of and later on reporting of infections. The main idea was already discussed in the community through various community projects such as DP3T. In order to discuss digital contact tracing, we assembled a great list of panelists, starting with Moti Young from Google, one of the companies that introduced the exposure notification framework, Carly Kind, a director of the Ada Lovelace Institute, a human rights lawyer and an authority in all things at the intersection of legal and digital. Ciro Catuto, professor at University of Torino, and also a digital epidemiologist and a computer scientist. Carmela Troncoso, professor at EPFL, a privacy researcher and one of the main people behind the DP3T project. Stefano Tesaro, one of the main people behind the PACT project and professor at University of Washington. In order to start this panel and to start the discussion, I asked panelists to answer the following questions. So each panelist will answer one of these questions. Questions are related to discrimination, tracking, stigmatization. Should we be deploying contact tracing given the risks of such things happening to the users, especially since this system is envisioned to be deployed on a large scale among millions of users in each country? About the usefulness of digital contact tracing compared to manual contact tracing, and also in general, how useful is contact tracing? Do we want to rely, or should we rely, or do we have to rely on Google and Apple to deploy parts of contact tracing for us? This is a question mainly aimed at Moti as a representative of Google. Can we even make contact tracing secure and private? Are there any inherent limitations that would make these systems so insecure and or so privacy violating that we wouldn't want to deploy them? This is a question that goes initially to Stefano, And finally, a question for Carmela: what did we learn from current deployments? We have contact tracing now deployed in several countries. Are there any success stories, any failures? How do we move on? For the rest of the attendees, please use Slack to raise questions to the panelists, and we will not be able to cover all of these questions that you raise, but please keep the discussion going on Slack. And now to the answers from the panelists.
Is digital contact tracing useful in general and compared to manual contact tracing? Let me recap some of the basic ideas behind this type of intervention. We know that infected individuals are contagious 1 to 3 days before they develop symptoms. So if we limit ourselves to isolating symptomatic individuals, we are one step behind of the virus. However, the opportunity of contact tracing, both manual and digital, is to use information sources that we might have available and collect extra data to identify contacts of known cases and ask these contacts to self-quarantine. And in this case, we have the opportunity to get ahead of the virus. The basic science of digital contact tracing, in general of fast contact tracing, was worked out in this science paper by Luca Ferretti, Christoph Fraser, and collaborators, where they studied the interplay of two non-pharmaceutical interventions: the isolation of symptomatic cases, this is what you see in the x-axis here, and the quarantining of their contacts. And what we learned from this study is that if you have a high enough success rate in isolating cases and in identifying and quarantining their contacts, then you end up in the top right region of the diagram, where you have a negative amplification rate for the epidemic, and you can contain it. This is based on a model. The model has a number of assumptions, but this is a strong indication that the strategy might be viable and motivated a lot of the contact tracing apps that we are seeing today. Key points about digital contact tracing are that it is not meant to replace manual contact tracing. Manual contact tracing has access to all sorts of additional information and context, which is relevant to reliably identify contacts. For digital contact tracing, we use a physical proxy, for example, close range proximity as detected by Bluetooth. And of course, this comes with very limited context. So it's important to understand that these two strategies have to dovetail together. But digital contact tracing is useful in that it allows scale, and it allows speed. We only have a few days time window to react as far as detected contacts are concerned. And so being able to piggyback a digital platform is a potentially huge advantage. And of course, the scalability comes with a relatively low cost for this type of interventions. Now, moving ahead, it's important to study how digital contact tracing and manual contact tracing work in simulation on top of real data from human contact. And there is ongoing work right now on using high resolution proximity data collected by proximity sensors, as you see here in the left from the Sociopatterns project, or by using smartphones and Bluetooth-based proximity. This is the Copenhagen network study by Sune Lehmann and collaborators. These data allow us to simulate how these type of interventions work together and to understand some pretty complex interplays between them. And if you want to read more about them, here you can find a few references. Thank you.
Hi everyone, my name is Carly Kind and I'm the director of the Ada Lovelace Institute, and we're a research institute with a remit to ensure that data and AI work for people in society. In April of this year, we undertook a rapid evidence review just prior to the first generation of digital contact tracing apps being rolled out in Europe. And we asked the question, is there enough evidence to support the rollout of digital contact tracing apps? And at that time, we found the answer to be no. And to be frank, that situation hasn't changed dramatically. That is, in the intervening months, we haven't seen the evidence to support the investment in digital contact tracing apps that we're seeing across Western Europe and in the US. And that relates to a number of different factors. There is, of course, the technical considerations. Does the Bluetooth technology work adequately to detect proximity between mobile phones? And there is still a number of questions about how effective Bluetooth is at doing that accurately. There are also questions around the behavioural aspects of using digital contact tracing apps. We don't yet know whether people strictly abide by notifications given to them by contact tracing apps. We don't yet know whether they're more or less likely to leave their phone at home when they start to get notifications. And we haven't explored yet how things like the financial impact of self-isolating as a result of a notification from a digital contact tracing app affects people's behaviour, and whether people from particular demographics are more likely to comply than others. And we also haven't yet understood how the very real problem of digital exclusion and not enough people having access to smartphones interplays with digital contact tracing technology, in particular given that COVID particularly disproportionately impacts people of old age, for example, or from particular communities who might be less likely to have access to a smartphone. So there's lots of unknowns still. We haven't seen the evidence from any country currently deploying digital contact tracing apps that they've been a decisive factor in an effective pandemic response. Indeed, in places like Australia, digital contact tracing app there, which has quite a considerable percentage of uptake amongst the population, hasn't led to the identification of any new contacts that weren't otherwise discovered through manual contact tracing. And we have evidence from places like Iceland that the digital contact tracing app there was not a decisive factor in their response. So at this stage, it doesn't feel like there is the evidence to support considerable investment in contact tracing apps, although the situation is, of course, complicated and we should be exploring multiple options, but it's certainly not a clear-cut issue.
A very important question is to which extent Bluetooth-based exposure notification can be made secure and private. And this question is actually very tricky. To start with, a certain loss of privacy is already inherent in the exposure notification functionality, no matter how securely it is actually implemented. For example, if I am alerted about an exposure and I only met a single person over the last few days, I can reliably de-anonymize one user in the system who has been infected. This is clearly unavoidable. But even beyond this, it is very difficult to define what best possible security and privacy even means in this context. And this is also due to the diversity of trust assumptions that are made in this context, which all come with their own attack vectors and threat models. But what we do know is that also simple decentralized exposure notification protocols like the one by Google and Apple fail to achieve whatever best possible security and privacy means. They do guarantee a very high degree of security and privacy, but they are subject to certain attacks. These attacks are either against the security of the protocol, typically relay and replay attacks, but also against privacy. And in particular, they affect the privacy potentially of those users that report as positive, for whom previously broadcast identifiers can, to a certain extent, be linked together. So this has actually led to the development of several protocols which show that actually we can do better in terms of security and privacy, but it has been generally been very hard to deploy ideas from these protocols at scale, and this is almost always due to a combination of recurring policy and technical constraints in the deployment of exposure notification. So the bottom line is that the Google and Apple protocol is already deployed, is the most widely adopted one, and it's really likely here to stay. And so the real question, which I hope we are going to discuss in the panel later on, is to which extent existing privacy and the security weaknesses are an actual problem in practice.
A key learning for me is that what we do on a paper, design and implement the protocol, is really the easy part. The hard problems came when we had to integrate this protocol into an app and a very complex health system. We had to design many other components, such as new authorization schemes, new tools to protect the privacy of network traffic, new ways of logging information in different cloud components so that privacy could not be breached, and uncountable hours of research on Bluetooth to make it a proximity detection technology. We also learned that if one decides to do an app, that means that one marries the platform. And that means that Google and Apple have the right to decide what can be done, who can do it, and when can it be done, as they release different versions of the API. And that hints that privacy is actually the easy part to ensure from a technical perspective, but governance is very hard problem. We also discovered that even of those caveats, implementing the system is really the easy part. Engagement is the real challenge. How to make users who fear surveillance and governance and health authorities that lack the expertise to understand how they can use the app and the benefits took a lot of time and effort in the communications. And at the very end, does it really work? So far we have been running this for very little time, and the privacy measures avoid that we can collect a lot of data. But for Switzerland, I can tell you that from the 2 million downloads that we have, 1.2 million users have the app running. That's a 15% of the adult population. And we also know that 9% of the positive PCR tests that are done in the country ask for a code and upload their data to the system. Each of these codes, on average, triggers 0.8 calls to the system. And that seems little, but we know that many other users that are notified actually go directly to take a test or call their family doctors, and we cannot count those users. So overall, we think that the app is actually triggering notification and is helping preventing the spread of the pandemic.
Okay, very good. So I would ask all the panelists now to turn on their cameras, and Motti, I think the floor is yours. So the last question that I asked the panelists related to the Google and Apple exposure notification framework, and how does this play into this whole story? So should we trust or rely on such frameworks, or do we even have a choice? So Motti?
Yes, so I, over the years, I think more than 30 years, I had many opportunities to move to academia, but I chose to stay in industry. And the reason being mainly that you can, in industry, you work in two, I can work in two modes. I can be completely theoretical and develop new crypto systems. On the other hand, I can look at actual real world problems and start solving them and work on this. So when we look at real world problems, the maxim of the fact that, actually it's a maxim, but it's a fact that the best is the enemy of the good holds. You have in real life to make hard decisions. What do you do given the set of constraints? And this came up in March. I started to look at it. I read the CDC and what people do in epidemic and pandemic situation, and what you can do. On the other hand, as a technology, you have to look what are the tools that you have now that were not there in 1918 in the previous pandemic, and you do, and you don't hope to solve things in a very theoretical way that you have a theorem, blah blah blah. It has all the nice property, QED, and then you cannot do anything with it. You have to compromise. You have to take all the dimensions of utility, security and privacy, and users, and many aspects into account. And I started to circulate potential technologies in the company, and this came out. And of course, BLE, I was on a previous project, the Eddystone beacons, so I was familiar with the technology and proximity. And I was thinking about the decentralized approach from the beginning, because if, given the pandemic, we give our privacy for this, then the next step is for something else, and the third step will be for something else. And you know, privacy is a property that you can give up, but you cannot regain at many places. So I don't yet answer the initial question whether we have to rely on Apple and Google. I just want to say that it became an effort of many engineers and other people in technology and in related areas in the two companies, with the simple goal to do something that is useful in our
Did I freeze or
new world of smartphones? Before we didn't have smartphones. In the process, advanced computing system, advance a notion, this will be my last statement, advance a notion of compute as much as possible with the least possible information. Thank you.
So thank you, Moti, and we'll circle back on the issue of governance. So essentially, you know, if we would have free hands, how would these contact tracing systems be governed? So thank you, Stefano, for raising this issue. But I want to start by addressing some of the first statements of the panelists. So I'll ask Carmela the following question. So it seems that Carly is somewhat unconvinced that digital contact tracing is somehow worth the risk and also the cost. And you see benefits. So can you maybe comment on Carly's statement, and then I'll ask Carly later on to respond as well.
First, I'll say that I think that Carly is spot on, right? We're spending a lot of money and a lot of effort on actually doing this. But the question to me when I came to this world of contact tracing, which as many people that know me know was not my particular passion, was that there was no option about if we're going to have an app or not. We were going to have an app. And then at that point, it was very important to minimize the risk that what this app could do afterwards, right? As Moti was saying, it was very important to avoid that this app could become an infrastructure that could be used for further things than this contact tracing. And that was most of the push that we did. And so far, I have to say as well, as being involved in one of these developments, that answering the question that appeared on the Slack many times, do we have proof? Do we have evidence? We have been running this thing for a month. So there is not much data. And also we have to say that we did a very good job at this privacy thing. That means that there is very little data and there are very few places in the system which we can actually tap. In fact, there is a lot of the system we cannot see. We don't see how many notifications are responded. As I said in my video, some people do follow orders and call the hotline. Some go directly to the test service, and then we cannot observe all of these things. But what we see so far is that notifications are being sent and people are being tested. And to me, even if we just, save 10 chains of infection, given the exponential growth of this disease, we're already saving lives. So we will see what are the things, and I totally agree that we don't have evidence yet. But my takeaway from this is that since it seems that having an app was a must because governments were going to put it, what we have right now may be one of the best options that we're on the table.
So maybe to expand, to give more information here. So some governments reported costs to develop this and to run this app between a few millions to tens of millions. And so maybe now the question to Carly. So do you think that sort of this cost is your concern, or is it some risks to vulnerable populations or populations in general that bothers you so much, or do you absolutely see no utility in this? Or maybe I misunderstood your statement.
No, that's useful. No, I mean, I should say I start from the point, which is if technology can help the pandemic response, we should use it. Absolutely. I think the concern around contact tracing is one around process, and it's broader than just this app. It's how should governments deploy and use technology, in which circumstances, and what process should they follow? And I think when governments deploy technology, it's different from Google developing a piece of tech. Moti spoke about how you need to think about utility and you think about compromise. And I think that makes a lot of sense from a company's perspective. That's how you develop a product. From the perspective of a government, they have other obligations, including making sure that everybody is accounted for, particularly the most vulnerable and those vulnerable to discrimination and other problems. And so a different process has to be followed. That's not about what works for the majority, but about what works for everyone, and how do we make sure protections are in place and nobody gets left behind, et cetera, et cetera. So I think when it comes to government technology development, you're trying to marry what has traditionally been a very agile process that's about moving fast and breaking things, and then what has to be by necessity a kind of slow democratic process that's about bringing people on board, making sure there's evidence, making sure there's oversight and review. And I think that's just a really difficult thing to marry. We're trying to do it in a pandemic. And so that's the perspective from which I raise concerns, not from a kind of neo-Luddite perspective that we shouldn't use tech in this pandemic to help. So I think then when on your question around cost benefit, so in the UK, they spent around, apparently, reportedly, they spent around £12 million on the first generation of the app, which has now been binned, and the second generation of the app has been launched today, which is based on the Google Apple API. Is that worth it? I think it's a really difficult question to answer because it also involves knowing what resources went in that direction that could have gone in other directions, and what were those other directions. So in the UK, for example, we haven't had widespread testing available until recent weeks, and months into the pandemic, you weren't able to get a test. So what was the trade-offs made there in terms of investment from public health? Did more go into the app than went into testing? And I think I could go on and on about these types of questions about what risk assessment has been done. How do we think about the fact that the majority of people who are vulnerable to COVID are over the age of 60? Those are the same people who don't use smartphones. How do we make sure that this type of system really accounts for those who are most vulnerable to this disease? There's a range of different questions that need to get asked. And my concern is, what is the process that's in place to make sure those questions get asked?
Okay, I want to follow up on what you just said, and then we can circle back to the technical risks with Stefano. I want to connect this to the question of governance. So, I mean, this is anyone on the panel, whoever wants to answer this. So, what would be an ideal process? So, a number of countries were complaining about Google and Apple sort of role in this whole ecosystem, and also constraining certain functionalities of how this application can be run. For those of you that don't know, how beacons can be recorded directly by the app and also transmitted directly from the app. So this was a main kind of point of contention, and restricted essentially how the apps can be constructed. So how can this be resolved? So it seems that some governments were happy with this, some governments were not. So how can one govern such a system?
I'm not an expert on government and running governments, and I hope never to be. But public health is important. This thing has, for example, the exposure notification never meant to be the full solution. So let's take the social welfare or social warrior or social whatever aspects of it. If you know that you have a certain portion of the city that has rich people with smartphones and poor portions of the city, then you can redirect your resources for manual contact tracing to the poor population rather than spreading it all over, because you can rely on the exposure notification in the rich area. So this is how apps like this can help the government balance resources and actually help the poor, the thing that people expressed so much worry about them suffering, actually, because there are complement processes and resources that can be, by solid governance, be distributed in an imbalanced but fair way, so that it can help even the social aspects.
Let me maybe even make the question a little bit more technical. So what should be the functionality that should run in an app versus an operating system in such in such a constellation, right? Given the sensitivity of information, given the control that the governments want, and so on. But feel free to, yeah.
So I think that you asked about governance, not government. Governance is about who has the right to decide when the app starts, when the app ends, and what the app does. And this marriage that we have now with Google and Apple, which hopefully it's a convenience marriage and so far it's working, but it's also one in which the balance of power in this sense may not be hyper-balanced, because when is available is actually something that we have some dependence on. And that is something that has not been discussed or has actually been imposed. And there is a big question about what is the future of this, right? To which point, even if there are certain systems, the ones that run the app, there is still a strong dependence, as I was saying in my talk, that I am very curious to see how this develops in the future. The second thing that goes with Carlos' statement about how do we make sure that these apps actually affect, that has to go with the government and what else needs to be deployed together with the app. In the case of Switzerland, I'm going to speak a lot about Switzerland because it's what I know about. There were laws that were deployed together with the app to make sure that the economical impact was not so big. So when you get a notification from the app, it's the same thing as as having a sick leave. People get the same kind of unemployment benefits, which in other countries that don't have the same social benefits, and the US is a great example for this, this may actually be a big issue. Because even in the case where we have, as Kali was saying, like the case where poor places are more affected, when you put the app inside, even if they have phones, that means that because of what we want to do with the app, which is the speed, we're going to have more notifications. This means that we're going to send more people home, right? This is one of the main worries of every government. How are they going to do the support? And how do we create such a good socio-economical environment for these apps is something that is very hard. And I'm not sure. I would like to know, are we doing enough? Is it enough with kind of the things that we have put in place in Switzerland? What else need to be done? And especially what else need to be done in other type of societies that maybe don't have the same nice benefits as we enjoy here.
Do we have other panelists that want to address this topic?
I wanted to just add something to this topic very briefly. When we discuss here about the role of Apple and Google, I think one non-obvious point that hasn't come up yet is that Apple and Google also define the interface needed to work on top of their APIs. And there's a certain cost to be able to interact with them, and the level of granularity was decided by them. And I think it has been a little bit of a problem in some cases, and this might affect some also the issues that Carly has been addressing. For example, in the US, many of you are in the US, and as you notice, the adoption of these apps is at a very different stage than it is in Europe. And I think there's an issue of granularity that the decision was to talk with states. And not all states are at the same level of evolution in technological terms or at the same stage of fighting COVID. And what I've seen when just for context, I worked before on an app developed at the University of Washington that was before independent of the Apple and Google APIs. And what we have seen when this app came public is that most of the efforts to deploy contact tracing were coming from the bottom. So universities in particular, we were swamped by universities and also local jurisdictions that wanted to adopt contact tracing. And there was no way to do that within the existing framework because they would have to adopt something which is outside of the Google Apple API framework. And so it's integrated much less with phones, and then that has been a problem, right? So I think it's important to decide at which level you want to push for adoption, and it's not always the same. So Europe might function well at the national level. That was obviously not the case in the US, and that's another barrier that comes up.
Let me just add something that in the US adoption is slow. Virginia is the first state to have it run and launched, but it's known that there are 20 or more by now regions and states that have adopted it, and it covers a big portion of the population. So with all the difficulties, and difficulties were expected and are still expected, things are moving.
So in So then we'll postpone the risks question that I'm aiming for Stefano to maybe piggyback on what you just mentioned, Moti. So there were a lot of questions by on Slack regarding interoperability. So I don't know who wants to answer this. I know that Carmela was involved in interoperability in Europe. So, but if anyone wants to comment on how interoperability works, or can it be even done? Or are there any challenges that you want to speak about?
So how these apps work, right, is that we have these Bluetooth beacons that go around. You record beacons that you see. Eventually you get sick. You upload your key that allows to drive these beacons to a server. The rest of the phones get these keys, and they can check whether they have seen you and then compute with the data that they collected, whether this exposure has been long enough. So when we want interoperability within countries, we want that the people that visited a country and therefore saw beacons from that country, or in the case of the United States, this can be states, they are able to get access to the keys from that place that is not their home. And also that the other way around, right? That keys from these people that have visited that country are accessible to the citizens of that other country, so that they can check if this person, when they went home, was sick, they still get notified. So we need something that makes these two flows happen. And this can be done in many ways, right? The first thing is just a normal peer-to-peer, in which the service between the countries just send these things to each other. The current solution in Europe seems to be a gateway server that just makes, it's a relay basically, that just instead of having a peer-to-peer, we have a star topology in which we send to this gateway server, and then the server distributes the key elsewhere. And this way you can ensure that everyone kind of gets access to all of the possible matches that you have. So this part is kind of very simple, and in this sense, the Google and Apple API kind of facilitate this a lot, because that means that all of us are running the same protocol, and that even if you're in another country and you would need to get access to that particular country's system, you can install the app and still get the beacons that you have in the lower part of the system.
Okay, so I can follow up with you on that because there was a lot of discussion on Slack on that. But I want to switch topics to something that Stefano mentioned in his intro, and that are all the risks. So you mentioned a number of possible attacks on these systems, and some are unavoidable risks, right? I mean, they're sort of there to stay. So, you know, how do you do a risk analysis on this? And you know, do you find the risks acceptable? And this is maybe also a question to Moti, who probably looked into that as well, and Carmela. So can you comment on that? All these relay attacks, all these possible privacy attacks, and so forth.
Should I start? Okay. So first of all, I think many in the audience know, and here on the panel, so it's a bit of an ill-posed question. How do we do a risk analysis on an entire deployed system in a rigorous way? So I agree with Martin. That's definitely a lesson I learned as a cryptographer going through the entire contact tracing experience, that if you want to deploy things at scale, you need to make some compromises. And the one compromise that was made here for scalability, that I think, just to be clear, I was referring to in the panel, is the issue that as a positive user, so once you report positive and you're authorized to upload to the system, the identifiers that you have broadcast over the last 2 weeks or whatever period health authorities decide is relevant, can be linked together either across days. Typically, this would be across an individual day. And the question is, should we be concerned about this? So this is one type of attack, that is particular, the one that affects privacy. Should we be concerned about this or not? And I think here, you know, the real risk analysis is very subjective, right? So some of us might be fine with this, just because we think that once we are positive, it's not a big loss to potentially reveal this information. And of course, granted that it takes some effort to be able to make this information useful. That will mean having some antennas in the surveillance equipment being distributed on a certain territory, and that's definitely a non-trivial attack to mount. So I think it's important here. The only thing I can say, it's important for users to understand this risk, and they can decide individually whether they are willing to take the risk or not. Also, I think another issue is that one needs to measure how for example, an important question here is, can user be coerced to upload? And maybe this is something that can be made as hard as possible as a local policy that health authorities can be paid attention to. There are other risks that are related to relay and replay attacks. So here, I think these are mostly attacks that can create a number of false positives in the system. I am a bit personally less concerned about them. Maybe people can disagree here. I feel if the reliability of the system becomes affected at some point, things are going to look obvious, at least in certain areas, and then some interventions can be made. And the worst that can happen, of course, is that the system is not trusted, which is definitely a big deal if you want the system to be effective, but it will not affect privacy of individual users. Some of these attacks can be prevented to a certain degree. There have been some solutions that are proposed, but again, for different policy and technical reasons, these are hard to scale and also to adopt. Another thing that I want to point out is that some of these risks are not going to go away. And this is something which is very important for me to stress if we adopt even solutions with better security. So the attacks become a little bit harder, but it's very hard to make even a risk analysis of what is leaked in a perfectly secure solution that just implements the ideal functionality. If you're using this in a situation where there's a limited number of cases, just the fact that suddenly two users receive an exposure alert, they might be able to conclude that these belong to the same user, especially if they're in close proximity. So it's a very hard question to answer. So, and I think the situation is here to stay, and the only thing we can do is inform users.
Moti, you want to say something on this, or?
Yeah, I can state a few things. First of all, the API is named exposure notification. So trying to apply complete privacy to something that is called exposure is an oxymoron. So you have to understand that to start with, just starting the system and doing something, you have certain exposures. Now, in the state of thinking about it, both in both companies and independently in both companies, we came up with a lot of the other academic paper attacks and concerns, and we boiled them into, and we had to do. Actually, it's not exactly only risk analysis, but it's a utility versus risk analysis. Because we were aware, I mean, the entire group of engineers in both companies were aware of the capabilities of BLE, what can be done, what can be done more reliably, what can be measured, and so on. I mean, we are still studying it, of course, carefully. But this was known, and then all the risk, all the exposure, and what makes sense, what does not make sense. The biggest exposure is
what would change? Maybe there was a question on Slack, and I want to capture it because I think it's an interesting one. How comfortable would all of you be if these contact tracing apps would be deployed per company or in companies, sort of reducing this context? So because there are ideas to deploy them in various companies where people work, because of the unavailability in certain jurisdictions. So any opinions on that?
The first thing I have to say is that obligation by employers or restaurants to use these apps was one of our main concerns, that people would be discriminated for not having the app. We are discovering that this goes the other way around. In particular, companies do not want their employees to use these apps. We're finding this a lot because people don't want to have notifications, because then people need to quarantine and they don't work. And this seems to be problematic. So that's one thing. And honestly, I don't know, Carl, if you foresee that, that's something I had not foreseen, that there was an opposite. On the other hand, I find that the deployment of this kind of technologies internal for a company kind of dangerous. Because depending that a company, and in particular in the US, when then you don't have the right to privacy, what prevents the company from also putting Bluetooth sniffers and actually do all of these tracking things that we believe that they have very low risk in public? They start to have very high risk when you put this on a warehouse or inside on things like this. So I would be very, very wary of deploying this type of technologies. And I would be much more helpful if these companies actually would put pressure on their governments to deploy the national app instead of doing it themselves.
I don't know, Carly, if you want to.
Yeah, I mean, I agree with most of everything Carmela says. I mean, firstly, also from a pragmatic perspective, how would companies enforce such a obligation? Would they require employees to open their phone and show that the app was being in use, that Bluetooth had been enabled, that they were carrying their phone with them? I think that practically it's a difficult requirement to enforce. I think what we're more likely to see, rather than companies require employees to use exposure notification apps, is companies require employees to use what is likely to come next, which is around immunity passport or immunity verification tools or apps. So something that would establish either a vaccination status or antibody tests, and making that attempts to make that a prerequisite to entering a workplace. And there, from a legal perspective, you get into a whole range of different problems, because under the GDPR in Europe, not under the GDPR, under various pieces of legislation, at least in the UK, and I think some of it's mirrored in Europe, you can't require employees to take certain tests before returning to work, and it might invoke something like discrimination on the basis of health status if you're not able to enter a place because you don't have immunity to coronavirus. So I think that we're getting into quite dicey territory when we talk about kind of mandatory requirements to use any types of technologies, and really practically a difficulty in enforcement, actually.
I want to now switch maybe topics and ask Ciro a couple of questions. So first of all, you have been doing a lot of work with BLE, so Bluetooth technologies and tracking contacts and so on in different contexts. And so is this the right technology? I mean, are there any other technologies that would work better in terms of tracking contacts or studying this area in general? You know, and also in terms of digital contact tracing, is what we are getting out of such systems too narrow? Is there, you know, what more as computer scientists could we provide to help this, to help the epidemiologists or the governments, you know, better manage the situation? Is this what we are currently doing somewhat narrow, or how do you see this?
On the first question, it's important to remark that using digital proxies, in particular using low power radio signals to study close range proximity of humans, is not a new idea. There is at least 1 decade of research on using all sorts of digital proxies to mine for proximity relations of individuals. And we know that these signals are useful to study infectious disease dynamics, especially in hospital settings and in a variety of other settings. So the fact that we can use a digital proxy to inform modeling strategies and targeted interventions aimed at mitigating epidemic spread for an airborne pathogen is something that, that we know as a fact. Now, the thing is that a lot of the literature and a lot of the studies that were carried out in the last 10, 15 years in this space have used specialized technologies, custom technology, all sorts of low power radio devices, infrared-based proximity, a mix of different type of signal, multimodal devices, and so on and so forth. So typically these devices were designed from the outset to sense for specific spatial relations of the individuals wearing them. Individuals typically are asked to wear these devices in a controlled fashion. Normally this yields higher quality proximity sensing and downstream better proxies for the spatial relations that we think are most relevant for the spread of the disease. So we don't have this luxury with Bluetooth. Comparing like the use of Bluetooth with the state of the art of these other efforts, there are two main problems. The first one is that there is a massive heterogeneity in the radio interfaces of different Bluetooth chipsets. And of course, we can somehow like fix this by calibrating, creating databases of calibration information for the different devices. And this is being done, as you know. The second thing is that there is a lot of heterogeneity in the behaviors of wearing a smartphone on your body and using a smartphone. And of course, as you imagine, if the smartphone is sitting in the back of your pocket, or if you're holding it in your hands, if you're holding it in your hands in front of a metal surface, imagine a metal table in a cafeteria, all of these things can make a big difference. However, we do know that if you filter for long-lasting, strong contacts, you pay a steep price in terms of recall, but you do tend to get high-quality, epidemiologically relevant contacts. And this is why it's so complex to actually fine-tune how digital contact tracing dovetails with manual contact tracing, because it's really a complementary type of signal. We are dealing with a proxy, and there are many knobs that we can turn that control how this behaves in complement with the rest of the system. Keep in mind that going forward, we are looking at a slow burn for this epidemic. This is not going away fast, of course. Even in situations where you control it, you will keep seeing like bouts of epidemic locally. And so having some communities where the adoption of the app is higher will allow us to stave off those kind of outbreaks. And of course, there are biases in the populations that will be able to use these devices, but keep in mind that they don't translate trivially into biases in the benefits, because we are dealing with an epidemic, which is a network process. So we have a lot of network effects. And it's not simply that because of the biased population of smartphone users, then only those guys benefit. There are network effects, and if we are above some of the good relevant thresholds that many people are studying right now, everybody will benefit out of this. Final comment, I mean, Bluetooth is the technology we have today. I mean, there are some operational constraints here. Like I am part of the Italian government COVID-19 task force, and from the outset, we were going to have an app. So this was never under decision. There was going to be an app. And so, of course, I second what Carmela said. We went eventually for the most privacy-preserving one because of the non-trivial cost-benefit trade-offs. And so you want to minimize the potential harm because you're going to get that for sure, whereas the public health benefit are something that we are still investigating.
Even in the interest of time, I want to ask you two more questions, and others are also welcome to answer. So there was one number floated in the news that one needs 60% or more people to install an app for this to work. And the second issue was, how concerned are you about the inaccuracies of Bluetooth distance measurement? So because some people might see this as being a showstopper for this kind of apps. So maybe you can discuss these kind of.
I'll quickly take the second. Regarding the second, no proxy is perfect, and Bluetooth-based proximity is not going to be perfect. But keep in mind that also manual contact tracing is not perfect because it relies on people remembering contacts, and people are known to have recall biases, or they simply might lack the information to recall where a given contact didn't happen. So I think that this is just another proxy that we are using. It's important to state clearly that this is a complement to whatever else we are doing. We are not going to get out of this with an app, of course. Nobody at this stage is so naive to think that, right? But this can be a useful, low-cost option. On the cost side, I would like to say that I'm familiar with the Italian experience. In Italy, the cost of developing the app was sustained entirely by the private company who developed the app and then donated the source code to the government. And so in a sense, the cost of developing the app itself and the cost of deploying it was relatively low, actually, and probably abysmal compared to the massive costs that all of our systems and countries are seeing because of the coronavirus crisis. So this is for the second question. Regarding the first question, the quality of the signal, as I mentioned, it's not perfect, but it's what we have today, and I'm pretty sure.
60%. So is that something that?
Oh yeah, sorry, got mixed up. That comes out of
the Oxford study.
I would say largely a misinterpretation of the early work by Ferretti and Fraser. There was not such a threshold. Of course, as you imagine, from basic principles, the benefit that you get in terms of contact recall is quadratic in the app adoption because you're involving two subjects, right? So you need to have a relatively high uptake of the app in order to see strong benefits. But keep in mind that you're not using only the app, you're not using the app in a fully homogeneous population, which is one of the strong assumptions actually of the model by Ferretti and Fraser. And we know that heterogeneities in this respect are probably helping us. And also, there is really no threshold effect. So you have a benefit which might be small with a very small adoption, but it does increase with adoption. And so there is a benefit there. And if you can neutralize the potential harm, this is surely helpful. That said, as Carmela was saying, we are in the early days. The systems we have deployed actually by design provide us with so little epidemiological information that it's difficult to assess the actual impact, but I expect that the public health authorities of the countries deploying these apps will start providing these apps in the coming weeks and months, but we are really in the early days.
Okay, thank you. So this is a security conference, so we see a lot of questions on Slack also related to potential attacks. So I will circle back to one attack that people seem to be very fond of and are exploring, and that's some sort of propagation of false infections in environments. So can anyone comment on that? I mean, there were a number of reports that were written on these topics already, but maybe someone can summarize what the main issues are and what and how at least the current framework defends against that or addresses it at least partially, if not entirely.
I can say something, but
I think.
Oh, Marty, you can. Yeah, up to you.
No. I think Surgeon is the expert to answer that.
I'm just moderating, so this time I'll let Stefano pick this up. So.
No, I think there are two concerns here, and I'm not sure which one the question was referring to. I mostly wanted to make this distinction, right? So I think an issue that has been discussed a lot at the beginning, and there have been several blog posts about it and discussed in articles, was really the issue that false reports are being done. And that part is really not an issue when integration with health authorities is taking place. So there are several mechanisms with different degrees of sophistication that can be adopted. Most of the solutions now use PIN codes, but clever things can also be done in distributing trust between central servers and authorities to authenticate uploads. That is not really the issue at this point. I think the one issue is exactly the one related to relay and replay attacks, which can still affect. That's of course a much harder attack to mount, and I don't have a clear evidence-based analysis of how feasible these things are going to happen, but they are technologically more sophisticated.
Yeah, I also invite people to read all the reports, and there have been a number now generated on this topic. So I think it would take some time. So we have 3 minutes left, and I would like to go back to the question that I asked Ciro, but there wasn't time to answer, and that's what else do you think we as a community should be doing except of this contact tracing that we somehow focused on? So there was a lot of, I could see in the community, a lot of willingness, a lot of positive energy to build all these apps and contact tracing systems. And people, and as Ciro also mentioned, a lot of companies as well, everyone jumped on board to do something, entirely for free to benefit the society. So is there something more that we could be doing except, making sure that contact tracing is as best as it can be? So, I mean, we have now 230 plus people on this, attending this panel, so maybe you can inspire someone to do something good. So Ciro?
I'll share just one bit. I think that it comes with complex trade-offs, but the possibility of creating privacy-preserving risk maps of locations might be useful. Of course, there are very strong arguments for not using location data at all, and this is at the core of of many of the designs that we are involved in. I mean, I'm also part of the DP3T collaboration.
Here's the benefit of here's the benefit of not having this panel in person, because I think Carmela would sort of oppose the use of location.
No, I'm also very skeptical that this can be done at all in any safe way. But location is certainly an important proxy. And so, like, I'm answering your question. Like, if we could raise the bar of what we can do in terms of using co-location data and create privacy-preserving risk maps in a distributed fashion, this could possibly be useful for epidemiologists. But I do agree, and again, I have to say it, I'm part of the DP3T collaboration myself, that right now, using location data, as far as I'm concerned, is a big no, and it's important that this is considered at the outset a hard constraint.
Okay, so thank you. Any last thoughts? Anything that you wanted to say and you didn't have time?
One thing is that security experts are very good in analyzing the worst case or the attack, but risk management is much more probabilistic, much more about possibilities, and much more trading utility versus gain. And you have to be very careful when you discourage people from using the app, because somebody can die. So, it's a balanced approach, and you have to take it in moderation. Everybody will be considered, everybody can be heard, but do it responsibly.
There is also another point which was made on the Slack channel. Don't forget how invasive and intrusive privacy-wise is manual contact tracing, and how that information, once materialized, can be abused. So scaling up manual contact tracing also comes with huge privacy risks, and having a surrogate, a complement, such as digital contact tracing, can certainly help.
And the other thing I want to say is that when we talk about it, we have been concentrated on the Bluetooth side and that part of the protocol. But as I said in my presentation, there are so many other mechanisms that need to be built that depend on the capabilities we have on the phone, and that we need much more research on how do we protect network communications, how do we get better authentication, can we get better authentication without having to trust the phone. There are a lot of low-hanging fruits, and I would love to see this community building not only on the protocol, but also on the other parts that are essential for the security and the privacy of the system.
Can I come in with one final comment, seeing as Motti has baited me so much to say something, which is only that we have to remember that this is the challenge is not only getting people to download the app, it's getting them to use it regularly, to abide by the notifications they receive over a very long period of time. In order to do that, you need to build trust. You need to build public trust in the app, and some of that comes with privacy preserving measures, other comes with processes and governance and the system in which the app's being used. And so what we found in the UK is actually using communications rhetoric such as, you have to do this because people will die, actually doesn't get that public trust element across. And the way the NHS has actually reframed communications around the app is to say, this is a good thing for you. This is how you get access to society again. This is how you get to go to restaurants and movie theaters, etc. And I think that's a whole nother conversation about what the public communication challenge is there around getting people to use it. But I know we're at the end of the conversation now, but yeah.
I just have one line I wanted to say. It is to second Carmela and Ciro, so in manual contact tracing and the bigger picture. So it's really important for this community also to understand, we haven't discussed it at all, that when we talk about contact tracing apps, it's really not just BLE. So we are seeing a proliferation of all sorts of other apps and solutions that have security and privacy issues. So we couldn't discuss this today, but to keep an eye also on that, because there's a lot happening there.
Absolutely, I think that's a great summary. Clearly, it was a short time, so we clearly focused on something that's prevalently deployed, but there are a lot of works, and I'm sure that there will be a number of submissions, and there are already a number of submissions along contact tracing and similar technologies to all major conferences. So be nice to submissions, as you usually are, I guess. And so I would like to thank our panelists. Thanks a lot for your time and your preparation, and thank you all all for attending and for your questions on Slack. And I think with this we are done. So thank you. Bye.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.